So potentially it could be a future where all of these different tools are funded and fleshed out, and then it's personalized for each person and their type of cancer and how
Yeah.
the body's going to
Yeah.
handle. That gives me so much hope. Yeah.
For
Wonderful.
example, children, they need something different. For a 20-year-old, it's something different. We need a war chest, right, of tools. It,
Yeah.
it just can't be the same chemo and same regimen. And we all know that. But change is tough. Change
Yeah.
is tough. So what happens is research comes up with discoveries. And if these discoveries aren't commercialized, then they never help anybody. This happens all the time. In fact, this is part of the big waste. We as citizens donate or give through our tax dollars billions to cancer research at all kinds of organizations all over our country. And they do amazing things, but that doesn't always mean when we're sick, we have that discovery and that medicine in hand, because there's a whole other world called the innovation world or the biotech world.
Yeah.
And they need to take these discoveries from academia and advance them into real products so that Pfizer or Merck or Roche will take it forward. And many of these early stage companies are failing not because the science is bad, but because they run out of money or they can't raise the money. I want to see all these ideas tried because where I sit, sometimes you don't know what works.
Right.
Sometimes the things you think won't work suddenly become the most important thing for a patient. I think we need to try and advance as many of these ideas as possible, and there's no shortage of them, using all kinds of different ways to kill cancer cells and to improve the patient journey and to get away from chemo and to really rethink how we fight and win the war on cancer.